Welcome back to your weekly checkup where hope, health, and energy meet real solutions. I'm Dr. Lazar. I'm joined by my amazing co-host, Jaden. Today, we're diving deep into a topic that could change your health, your family's health, maybe even your life. We're talking about the importance of patient-centered care. If you've ever felt dismissed, unheard, or like a number in a broken system, you're in the right place.
That's right. And we are going to expose why the medical model is dysfunctional and how it's leaving millions frustrated, and why chiropractic, especially the Lazar method, is the best secret in healthcare. This is not a theory, it's about real people overcoming conditions that they were told is untreatable. And today you'll hear how you can too.
If you're tired of being told there's nothing else we can do for you, pick up the phone, schedule your consultation right now. Our number is 866-521-WELL, 866-521-9355, or text the word HOPE to 734-274-5107. So here's the problem with the current system. I mean, we see it all the time, and it's not about bashing things, it's about finding solutions because the health of our society keeps declining. The impact that people can have on their society, on their family, and their leadership, and their church, and their organization, their community, that's going down. And so we're called to stand in that gap. And so that's what this show, as a standard, that's what this show is about. But specifically, this show is so we can stand in that gap and bridge that for you and your family to ultimately realize and express your full God-given potential. So the challenge that we see a lot is that assembly line approach in the sick care model. It's called healthcare, but it really shouldn't be called sick care because it's when you're sick that you go. But it's an assembly line approach, like that's what we notice a
Yeah, like a
lot.
one size fits all.
Right, right, right.
Another thing too that we notice and hear about a lot is like patients are reduced to lab numbers, like prescriptions, rushed 7-minute visits, and
That's why
stuff like
chronic
that.
sufferers like people with migraines, neuropathy, fibromyalgia, autism spectrum, POTS, failed surgeries, the things that are solvable in a 7-minute visit, that's why those people feel so abandoned and dismissed. And you know, I'm thinking of that couple that came in from Chicago who have been everywhere, and like she's dealing with foot drop. She's got so much nerve damage from her low back that she's dealing with foot drop. But the neurologist was saying like, yeah, you, know, you just need to exercise more. Like wasn't even noticing. And I think in that scenario, I think the husband had to kind of advocate and say, no, look, watch her walk in the hallway. And it shouldn't be like that.
Another thing too, so I mean, there are even statistics to back this up that show that 70% of healthcare costs go to chronic conditions, but the solutions are actually symptom changing, not root healing.
Yeah, that's true. They're just chasing the symptoms, and so they're not solutions, but they're touted as solutions. What would it mean if you could finally live without daily pain? I
I'm
love
sure
asking people that.
I'm sure even when we ask patients that, they have to think for a minute because sometimes they're like, I didn't even know that was possible because they're always told this is just something you have to live with, or it'll get better, or just take this medication, and then you won't feel this anymore, you know?
Right. Which in theory, I mean, we want people to feel good also, but our goal is not that people feel better. In fact, we talked about this a lot. Our goal is that you get better. Feeling better and getting better are not necessarily the sake thing. And the cool thing is when you get better, you feel more alive. And that's huge.
Can you share with our listeners the percentage of nerves that are actually telling you the pain that you're feeling?
9%. Yeah. Sensory nerves, uh, only 9% of your nerves transmit any sort of pain sensation. So if we're making our healthcare decisions with the system that controls everything based on 9% of the information, uh, I'd fire that CFO all day long, you know? But here's the thing. We see patients every day who we're told you're going to have to learn to live with it. And honestly, we refuse to accept that as the final answer. If that makes sense to you, we want you to call right now 866-521-well, 866-521-9355. Schedule your consultation, and here's our promise. We're concerned with two things: what's wrong and if our method can help. And if we can help you, we'll tell you. If we can't help you, we'll help you find somebody who can. So we promise not to waste your time. We're going to take a short break and we'll be back right after this. Welcome back to your weekly checkup. We're talking real solutions for patients who have felt and been abandoned in a archaic, broken, sick care model. And so we're talking about why it's important to have patient-centered care that is designed for solutions, not to keep you coming back and part of the system. And so this is, I mean, we're going to talk about in this segment what patient-centered care really means.
So I would say that the definition of like patient-centered care is care that starts with you, the patient, not the doctor's agenda.
And it really involves listening to the full story. There is so much, you'll learn in chiropractic school that the diagnosis is made on your butt. When you're sitting talking to the patient and they're telling you what's going on. There was a young lady yesterday that was telling me that her shoulder pain started, and then a month later, her POTS symptoms started, positional orthostatic tachycardia syndrome, where she would feel like she has to pass out whenever she would move too quickly, and it's autonomic and things. But most of the time, people would say, shoulder, POTS, nah. Well, here's the deal. It's her left shoulder. We can access the vagus nerve from outside the body on the left side. I mean, that's pretty close proximity. But if you're not listening to the full story, you're going to miss that kind of stuff, and you're going to just try to shut people up, unfortunately.
The amount of patients that come in and say, like, you guys listen, like that was the first thing that they noticed, because you go to other doctors and you're waiting in their waiting room for 40 minutes past your appointment time. You get in, you see them for 7 minutes, and they're rushing you in your visit, and then they don't even usually address the concern that you actually had, the reason you were there. And the whole way that we start our appointments is by sitting down and listening to you kind of explain and tell us what's going on. And I think that is huge. And the amount of patients, especially moms, who say nobody else was listening to me, like
Yeah.
I knew something was wrong and I was dismissed.
Moms are always right. I'll tell you that. They know. I mean, seriously, how stupid is it to think that just because you've gone to school forever that you know more about that person's baby?
When I had right after I had my son, he had a tongue tie, and I wanted it taken care of for his sake so that he could nurse, and nobody would do it. And I saw 3 or 4 different doctors, and the last doctor that I saw told me, he said, he kept trying to convince me he doesn't have a tongue tie. He doesn't have a tongue tie. And I said, but he's not eating. He won't latch. And he kept saying, well, just give it some more time. But this had already been almost a month after he was born, and I felt like it was too long. And he kept saying, I know what I'm doing. And I remember thinking, you're a middle-aged man who's not married with no kids trying to convince me that nothing is wrong with my kid.
Hmm.
Like, if you have to convince me that you know what you're doing, you don't know what you're
Yeah,
doing.
that's true. I agree. I mean, the thing is, it's about creating care with patients, not at patients, and that was violated in your story that you're sharing.
One of the things too, like the principles around patient-focused care would be dignity, respect. It's
Yes,
it's a
yes,
partnership. And there needs to be education involved. If you're telling me, oh, you're feeling this, that's whatever, give me a reason or tell me why. Or, it's okay that you're feeling like this, and here's actually why you're feeling like this, and let's
yeah,
get that taken care of.
yeah. That's huge. It's really, it's not about convincing people. When I mean, I teach all the time, without the why, they won't comply. If they don't understand why they need to do something, of course they're not going to do it. I wouldn't do it. Why would I disrupt my life for something I'm not even sure is going to work?
Yeah, you have to show them the value for their sake, like the what's in it for them. That's something we talk about all the time here, that everyone wants to know what's in it for me.
Yeah, and that's, I mean, 101. It's the opposite of, here's your script. We'll see you back here in 3 months and see if anything's any different, for
Right.
sure.
So we had a patient actually the other day who she came in crying and she was in so much pain and she had just gotten another cortisone injection, which
Mm.
those actually make you worse. That you feel better in the moment or you're not feeling as much pain, but your muscle it's actually weakening. Usually they do it a lot in knees.
Yeah, it'll tear up the soft tissue. Yeah.
But she was in so much pain, she couldn't sit down. It was painful to lay down, also painful to stand or walk. So she would just kind of like lean up against the high countertop. And she was in so much pain. We got her in, we got her adjusted, and then she was crying and she was saying, like, I already feel better because just we were listening to her and we told her like we can help you. This is fixable because she had been told this is not fixable. You're exaggerating. It's not that bad. That's not what you're feeling. And we always try to tell patients like you don't need just another quick fix or pop or whatever. You need to see someone who sees the whole you, the
Yeah.
whole
Yeah.
situation. And that's why the Lazar method exists.
Yeah, I love that point because it's not like, people will say there's no such thing as a quick fix. We know, like, we're not suggesting a quick fix. We're suggesting an actual fix. And that's totally different. This is your weekly checkup. Our number is 866-521-WELL, 866-521-9355. We're going to take a short break. We'll be back right after this. All right, I closed these shades. Look, there's still light. Look at this. There's what in the world? We got to set this up differently.
You're gonna be like this the whole time.
Yeah, I'll be moving my neck around. Welcome back to your weekly checkup. I'm Dr. Lazar here with Jaden, my amazing co-host.
I'm the boss.
Sure.
Today, we are talking about the importance of patient-centered care with the principles and practices that go along with it. If you are just now joining us, we've talked a little bit about why why we need to listen to the patient, not just go along with the doctor's agenda. And so,
Unless it's my agenda,
or mine.
then you're not a doctor yet. And then it's fine. If it's my agenda, it's fine. Just
Don't
kidding.
listen to Dr. Lazar.
Just kidding.
Listen to me.
So yeah, I mean, it is true. The the Lazar method was born out of a lack of results with other stuff. That's all it ever was. And I never intended for it to be a method. It was just kind of like, necessity is the mother of invention or adaptation, whatever. And so it ended up needing to be a comprehensive multimodality approach, with the foundation being unequivocally being an optimally functioning nervous system. I mean, that's without that, nothing works. But then we brought in some things that support that, and that's why we continue to see better and better results from people. I mean, all over the world. It's crazy. If you would have asked me however many years ago if people would, you know, come how far I'd say, oh, it'd probably come like an hour, maybe. I don't know. So that's been kind of cool what God's done with that.
Dr. Lazar won't like talk about it, but I will. So he's had patients fly in from Saudi Arabia. We do intensives. You can see if you're in the office and we have a new patient orientation, you'll see in that orientation the before and after of just one adjustment from patients from Saudi Arabia. We've had patients fly not just Dr. Lazar, but our whole family to Florida because she wanted to be adjusted while she was on vacation. So there are patients that truly appreciate and recognize the importance of this method. And I've grown up around it, so I'm used to it, but I've shadowed multiple other doctors. I've been in with different chiropractors. I've kind of seen all of it to make sure, is this what I want to do? And I have seen nothing that even comes close to or compares to the type of care that is here.
That that's cool to hear. That means a lot. So what are the pillars of our approach here?
So we have a couple different things that we use with care, but we use our biggest modality or main point is our QSM3. It's quantum spinal mechanics. It's an upper cervical it's a global correction where we are restoring the brain and body communication. That is our foundation.
Think about that for a second. If your brain and body aren't talking properly, bad stuff happens. I mean, that's as complicated as it is. If we cut the nerve to your heart's going to stop. If we pinch the nerve to your lungs aren't going to work as well. It doesn't matter what it's called, what the diagnosis is, your body's not working properly. And the reason we point out that these are global corrections is because we address the spine from the top, but one of the most effective things we help with are herniated discs in the low back. And so we have to be careful when we talk about upper cervical. Upper cervical care is no different than that would be like me saying, I'm going to go open that door handle. I'm not going to open the door handle. I'm going to use the door handle to open the door. I'm going to use the upper cervical spine, the upper neck where the skull sits on it to move the entire spine. That's why it's a global correction. That's why we measure all the way down to your feet to see what foot balance is and what your arches are doing and things.
When I explain upper cervical to patients in a way that makes sense when you hear it, the way that I'll say it is we are moving and we're correcting and adjusting. You'll hear those words a lot. The spine as a unit
Mm-hmm.
without forcefully manipulating. Oh my goodness,
Yeah, that's right.
forcefully manipulating your spine. Because you go to what we call a traditional chiropractic office, and they what do they call it? Flying seven. They do the same points every time. They pop your neck and crack your back and everything. And sometimes it actually does feel good or give you some immediate like relief, but it actually for most people, even patients we've seen in our office who say, "Oh, I've for 30 years been going to this chiropractor and I love them." We look at their x-rays and we're like, "Oh my goodness, you have bone on bone a couple spots in your spine. You absolutely should not be getting forceful adjustments because that will make your problem worse."
Yeah, the I think everyone's intention is to help. The flying
Mhm.
seven is that old school traditional come in, lie face down, get your low back adjusted, your mid back adjusted, right hip, turn over, right neck, left neck. That's we kind of unaffectionately call that the flying seven, where it's like the same for everybody is
Mhm.
kind of what that means. But we use a posture IQ that shows alignment changes visually, shows specific, it's specifically measuring to 1 millimeter under gravity. I think what one of the most important thing, the coolest though, is what distinguishes us from any other type of healthcare practitioner is our focus on the nervous system.
Yes, so we have nerve scans that we do here in our office. Three specific nerve scans that will tell us overall how your body is responding. Is your body, where's the blood flow versus where it's supposed to be? It shows us the stress within your body as well as your healing potential.
Which is huge. We if we know that ahead of time, we can map out the right plan. We do digital motion X-rays, so we can see function and structure. So that's pretty unique.
It's fascinating. We also have soft wave TRT, that's tissue regenerative technology. And the main point is it's cellular regeneration, it's tissue healing.
Yeah, that uses your body's stem cells to it's fascinating. We also use high intensity laser therapy that reduces inflammation on a cellular level. It speeds up soft tissue healing and repair by about 75%. So before or after surgeries, before or after injuries, really, really helpful.
I did laser after my C-section. So I was in labor for about 3 days in the hospital, and then I had a C-section. And I want to point out that I feel like I'm a very healthy person as far as I've been adjusted and everything. And I think the whole reason everything kind of went crazy with my labor and everything like that was because I was induced with chemicals. And, I think that speaks to this as the doctor's agenda. They needed me out. But I did laser right after my C-section, and I was cleared in about half the amount of time. 8 weeks is usually minimum without complications for healing recovery that they give
Where
you.
did you do laser?
Right on my scar,
Okay.
right where I had the incision. And in about 4.5, 5 weeks, I was actually cleared. And now I don't even have a scar. You can't even see it.
Yeah. I mean, the body's designed to heal. We just want to make it do that. We don't help your body heal. We remove the interference so your body can heal. Like it wants to heal.
Your body, we say a lot, innate intelligence.
That's exactly, yeah, you're born with it. We also have beamer circulation therapy. Better blood flow means better healing all day long. And we do functional lab panels. That reveals a lot of hidden metabolic drivers that we can address. Ultimately, though, the bottom line that we want people to understand is what?
Like the tribe mentality. You are never alone. We lock arms with you.
For sure. When we say patient-centered, we mean it. No one else combines these tools into one seamless system like we do. And I don't it feels weird with me saying that, but it's true and you're worth it. Like you're worth me telling the truth, even if it's awkward for me to say, like, hey, look what we put together. That's why people fly in from across the country, around the world. That's why we call it the Lazar method.
So if you are sick of chasing symptoms and you want answers, real answers, call us now at 866-521 866-521-9355, and we can get you scheduled.
We're going to take a short break. We'll be back right after this.
Welcome back. You are listening to Your Weekly Checkup with Dr. Lazar, and I'm Jaden. If you are just now joining us, today is about the power of patient-centered care, and this could be the day that you finally turn the page on your health story.
For sure. For sure. There are 7 principles of patient-centered care, and I think we should share those.
All right. The first one, um, they all seem so simple, but I feel like they're overlooked a lot. The first one is respect for the patient, for patient values, what they need, and their preferences.
For sure. There's also principle number 2 is coordination of care. There can be no silos. It can't be, ego gets people killed in war and in healthcare. Like there can't be different silos. There has to be a coordination of care, and everybody on your team has to work as a team, or they don't get to be on your team.
The third principle is to be clear, transparent with communication. We always say to be clear is to be kind. So if we're not being clear, we're not being fair to you. You deserve clear answers.
That's true. Principle number 4 is emotional support. That I think the sick care model tries to do that by bringing in, you know, social workers and things. And so I think that's a cool effort. We're big on emotional support because fear and anxiety matter. I mean, we're working with the nervous system. And so when somebody is stuck in a fear anxiety cycle, their sympathetic nervous system is engaged and they're not going to heal. And so sometimes that's the first thing that has to happen.
In my one of my favorite green books it's literally called, what is it? Healing Starts with Hope. Is that what it's
Yeah.
called? Or that's so we talk about that in the office, that even before we actually start actual we don't like to use the word treatments, but
Care.
care. Yeah, before we actually start your care, we want you to feel empowered, hopeful that there is a solution, and that is the beginning to your healing journey. The fifth principle that we talk about is involving family and community in healing, because those people are the ones who have seen you at your worst, but they're also the people that are there to support you and help you and hold you up. And even if you do have those bad days, to say, no, remember why this is where you were and this is where you are now, and you're going to get all the way over there.
Yeah, that's huge. Principle number 6, continuity and follow-up. It's not one and done. And it's not one and done for anything that works well in your life. Think about it. Your relationship with God is not one and done. That's a daily practice. Exercise and physical fitness is not one and done. Pulling weeds is not one and done. Brushing your teeth is not one and done. Showering is not one and done. Telling people you love them is not one and done. Continuity and follow up, like our small choices we make every day, are what create our entire future. And so, our care is not for people who want a one and done, because it doesn't work, it doesn't exist, and so we don't want to mislead. So we believe in the principle of continuity and follow up.
The seventh is access to care without red tape.
Dear Lord.
I think it speaks very clearly for itself. Dr. Lazar and I talk about this all the time. One of the things I that drives me crazy is when I go to a restaurant and I say, "Can I get, the salad, but can instead of ranch, can you put raspberry on it or something like that?" And they're like, "No, we don't do that." But I know they have raspberries, and I'll pay extra for the raspberries or whatever, and that just drives me insane.
Yeah, the red tape can be a challenge for sure. If you've been waiting for a sign to finally do something different and not do the same thing over and over again and expect different results, this is it. Our number is 866-521-9355, 866-521-9355. Why is this work, specifically upper cervical chiropractic, that component of it, actually the whole method, why is it the best kept secret? We say that a lot, but we got to back it up.
The first thing that came to my mind about it being the best kept secret is we are focusing on the root cause versus just masking symptoms. We want to fix the problem.
For sure. And understanding, I mean, the platform we stand on is that the nervous system is the master controller of the body. And that's not theory. I mean, Gray's Anatomy says the purpose of the brain and nervous system is to control and coordinate the function of every organ, gland, cell, tissue. One of those I've added, one of those is not in the definition, and I don't have it in front of me, so I forget. And to adapt that organism to its outside environment. So if it's hot and I should sweat, my nervous system allowed that to happen. If I'm scared and I should run, my nervous system allowed that to happen. If I eat food and I should digest it, and part of those nutrients need to go so my eyes work, my nervous system makes that happen. If I should fight infection and sleep and deal with pollen in the air, all of that is controlled by the nervous system. The nervous system uses other systems to carry out the actions, but the nervous system is the master controller of that. And so that better be checked often and tuned up and working well.
And I know we already touched a little bit ago how QSM3 or quantum spinal mechanics is different from popping and cracking, but I just want to focus on that again because we are moving the spine as a unit without forcefully manipulating or popping or cracking or twisting. The body is getting the adjustment that it needs, or at the neck, and your body is removing the interference and
Yeah.
working the way it should. And one of the things we like to inform everyone we can about this is because there are many MDs who don't understand the potential that chiropractic care has.
Yeah, that fortunately is getting better. I've got a lot of friends that are MDs and we work together, but the people that don't know, the people that are making assumptions, there was a cardiologist recently that told a patient, not to come in because this could be dangerous for her. And I thought, She didn't listen to him, thank God. But I'm like, how uninformed can somebody be? This is literally making things better. And ironically, upper cervical care helps with high blood pressure. Like, so that a cardiologist would say that was studied at Rush in Chicago in 2007 or something. I mean, it's published. It's like, ooh,
And what our patient told us too is she texted us like right away. She was like, I don't know why he's telling me this. She's like, I've been seeing him for years, but I've seen you guys a couple of days already and I'm already feeling better. You're the only people who are getting me results. You're explaining to me what's going on. And
yeah,
she was like, I don't want to and obviously we would never say, don't listen to your
I
doctor
say it
or
all the time. I do. If somebody tells you something stupid, don't listen to it.
well, that's true.
Seriously, I had a lady, this has probably been 15 years ago now. She came in a wheelchair, diagnosed with MS, did the x-rays, adjusted her in the wheelchair. She couldn't even get out of the wheelchair. No joke, within 2 weeks she's out of the wheelchair. I mean, life-changing results. And her neurologist said it must not have been MS. We must have misdiagnosed it because MS doesn't go away. And by the way, don't see a chiropractor. That's really dangerous for you.
That's actually illegal
Like,
for
yeah.
what
I
they
don't
say
hear that
that.
very often anymore, which is cool.
Yeah.
And we work together better. But there's definitely been some challenge. And here's the deal. Don't listen to anybody that's putting anybody else down. Like if the electrician is telling you don't need a plumber, that's stupid.
I always tell people that, like, if I don't have information, I'm not going to give you an answer that's, oh, definitely don't do that. Or without saying, I mean, I'll tell you, I'll, I'll look into it and I'll get you an answer. Or, I don't actually know much about that topic, but Dr. Lazar does. We can talk about that. But a lot of times, if people don't know or don't understand, they just say, don't do it.
Yeah, or I remember when you were little, you had a friend who this family had 3 kids. All 3 of them had stuff going on that we help with regularly. Not a far shot, but regularly. All 3 of them required surgeries. I think multiple surgeries
Mm-hmm.
actually, which is weird for different stuff. None of it was the same.
Mm-hmm.
And I remember shaking my head talking to their mom saying, "Why in the world would you start with surgery? Why would you do that instead of something?" And so I don't know.
Yeah,
People believe what they
we
believe.
did taekwondo together. We started at the same time, and my friend had to miss out for a while because she had scoliosis, which we see regularly. Like that is one of the things we help with a lot. And missing out on stuff with surgeries, and another one of their kids had brain surgery for seizures, which we helped with.
Yeah.
And
Yeah. It was,
crazy.
I don't get it. Migraines, those are gone. You talked about us going to Florida. There was, a lady that came in, 10-month migraine, went away under care. She went to Florida. I sent her to a colleague. Migraines came back. So she was like, all right, I'm not messing with that. Um, Neuropathy has been huge the last couple of years
Hmm.
and responded okay, here's the deal. Neuropathy is not hard to fix. It takes a long time to
Hmm.
fix and it takes consistency. But if I had a nickel for every time a patient told me that they were told there's nothing that can be done for neuropathy, it drives me nuts. That's not true at all.
In the
Yeah,
medicine that they're saying just take this instead, usually the biggest one I've seen is gabapentin, which is
yeah.
making it worse.
Well, it's blocking the sensation of the nerves dying off. So
Mhm.
it's getting worse, but you're just not feeling it. Um,
We help a lot of autistic, not just children, but anyone,
yeah.
improving and athletes peaking and
That
everything
was
like that.
big. So a guy was in yesterday, was hit knee to knee in football, could barely walk. Um, got adjusted his knee. I know we did the soft wave. I don't know if we did laser.
Yeah,
We
I
did
did
laser
laser.
also. He went to practice last night and was able to practice full out. I checked in after practice and he was able to go. He would have been off his feet for weeks. Seriously, he couldn't even bear weight. Uh, that's cool, man. That's good stuff.
So we've said it before, but I want to say it again. If chiropractic were a pill, it would be the most prescribed drug on the
I
planet.
love it.
But because it's not, it's ignored until now, and we're going to change that.
Yeah, that I think truly we got to update that statement because it's never been less ignored than it is now. It used
Yeah.
to be, but man, the number of people who are waking up and saying, you know what, this actually makes a ton of sense. In fact, I talked to a colleague today who was telling me that Amazon in 2022 bought like $65 billion worth of private practices to put together as a conglomerate because they know insurance is dead. They know that model is dead. And we've been saying it for years, don't wait for the medical system to catch up because it's not going to. Call us. Our number is 866-521-WELL, 866-521-9355. We're going to take a short break. We'll be back right after this. Welcome back to your weekly checkup. I'm Dr. Lazar here with Jaden, and we want you to know that you have every right to be empowered. You should have the power, take the power back for your health, your family's health. Don't listen to broken records. Don't listen to insurance systems. Don't listen to, fortunately, the government is starting to be supportive now, but for years, under Fauci's tutelage, we were getting sicker and sicker. Here's what you need to know. You're not broken. Bottom line, your body was designed to heal, but you need the right environment, the right guidance, the right tribe. That's what we provide. But you are not broken.
And it starts with just one single decision. Pick up the phone, call us, 734 274 5107. You can text that number as well, or 866-521-9355. You can call and you can schedule your complimentary consultation. It's normally $224 to meet with the doctor, but for being a listener, we want to thank you and offer that to you. You you can take your life back because nobody else will do it for you.
That's true. That's true. You've got to do it. Spots are limited. Don't say, I'll call next week. That's what keeps people stuck. Call us 866-521-WELL, 866-521-9355, or text HOPE right now to 734-274-5107. We'll be back right after this. Welcome back to your weekly checkup. Our number is 866-521-WELL, 866-521-9355. And if you're watching us online, if you would like and subscribe, I hate asking for that, but it's true. The more activity that happens on the line, just kidding, the higher we'll rate. And we don't care about ratings for ratings sake, but we do care about ratings for hope's sake. And we want
More
people to
people.
find this information. What's up with Dennis, man? Dentists have been showing up lately.
I normally people are they don't like the dentist, but I will say we have had so many patients come in from seeing a dentist. They say, "Oh, my TMJ, my trigeminal neuralgia, my whatever." There was a lady who was telling us the other day that she didn't tell this to her dentist, but she was having a really hard time swallowing. She went in for her routine 6-month visit. They took x-rays and they told her something is out of place in your neck and it's causing you're probably not swallowing right. They said you need to go see a chiropractor. And so the amount of patients that have come in just recently from referrals from
Yeah.
the dentist or oral surgeon even is awesome, and we're getting those patients the results that they're needing. And I can't stress enough the importance of a professional provider relationship
Yeah. It's
with
huge.
all things. We even like our patients if their provider for something different has a question about what we're doing, we'll say absolutely, we'll talk to them. And I think that's big too. And that goes back to the patient-centered care, providing care that the patient needs, what's in the patient's best interest, not just the doctor's agenda.
Well, and those, that's principle number 2 of our patient-centered principles. That coordination of care is what's got to happen. We've been working really well with a lot of physical therapists lately too, which is
Mhm.
great. For a long time, there was some unnecessary turf war beef between chiropractors and PTs. I get it. I think so anything after in Michigan, anything after 2007. So anybody licensed in Michigan as a chiropractor after 2007 had to also pass PT national boards. And I think the concerns were that there was going to be some, competition, which the reality is like nobody can take care of everybody anyway. But no, we have awesome relationships. In fact, we'd have to check, but I bet you we get more PT referrals than any other provider, which is super cool to me because I was taught that that would be the most contentious relationship, and it really isn't at all. Yeah, which is
What
cool.
I hear a lot too about PT is so we like to stay, and people say stay in your own lane, and that partially is our lane if we're trying to get you results. Also, if
Yeah,
there's
but
somebody who can do it,
that's the thing.
we don't need to.
There are
If
people who do
Mhm.
only that.
And they should do that. And
Right.
there are things that we do. So I think the reason for passing the boards really as a chiropractor is to know it's another step to understand how the body works and what works and what doesn't,
Sure.
and how the body works just in general. But if we can adjust, if Dr. Lazar can adjust and you can't, but you can do therapy, then we don't need to focus on therapy because
Yeah.
that's what you specialize in.
I've always really believed that. And I say, uh, you can't beat a man or a woman, doesn't matter. You can't beat a man at his own game.
Mhm.
Like if that's what they do. And so, yeah, that's a good point because yes, I've passed PT boards. Yes, I could do therapeutic activities, but there are people who do that better. There
Mhm.
are people who are equipped to do that, set up to do that, staffed to do that, resourced to do that. It's not that we couldn't, but we wouldn't do it as well.
Mhm.
And we believe you deserve the best. So what we do really well are we find interference in the nervous system. We remove that interference, usually by taking pressure off the brainstem. And then we get out of the way. We let your body heal how it needs to. Over the years, we have added those modalities of the soft wave TRT for stem cell activation. We've added the high intensity laser for soft tissue healing and repair. And we've added the circulation therapy. So we have added things to it, but none of those are actually to support
We've
so
seen the
your body
best
can heal.
results with it together for the majority.
Yeah, for sure. And that makes sense. You got to have nerve flow, got to have alignment, got to have cellular repair, got to have blood flow. I mean, those are some pretty foundational pieces. If you're just tuning in, this is your weekly checkup, 866-521-WELL, 866-521-9355. If you're listening live, give a call and ask your questions. And you can check us out at yourweeklycheckup.com. If you're watching online, please like and subscribe and share this with your peeps so they can have hope. We'll be back right after this.
Welcome back to Your Weekly Checkup. I'm Jaden with Dr. Lazar today, and we are talking about the importance of patient-centered care. So this next part, we're going to be talking about the myth that we hear so often of nothing can be done.
Oh,
We hear this all the time. There's nothing that can be done. So much so that even we say it if you're waiting, if you're calling us or on the radio, you'll hear it in the breaks. We'll say, if you've been told that you have to live with pain, there's a solution. So we talk about that. So why would you say that this phrase is a tragedy that patients are hearing this?
patients hear it as a life sentence. I mean, bottom line, if you're told you have to deal with something forever, that's crap, man. I mean, maybe you do, but like if your arm got cut off, well, even then you'd get a prosthetic. Yeah, I would just say it's not true.
So I would say in reality, it usually means we don't have another drug or surgery
That's
to
a
offer
great
you.
point. That's a
So
great point.
it's not the same as no options to exist. I mean, even in our office, we say if something we have here won't help you, there is something that will,
That's
and
right.
we will help you find it.
That's
We'll
right.
get you the help that you need.
Yeah, absolutely. The my executive assistant was working in a hospital system and was super, super, super vaccine injured from the experimental COVID shots. And she was told she'd never work again, she'd never walk again, she'd never run again, she'd never bike again. Um, all of those were not true. She
Mhm.
was able, her story, man, there wasn't a dry eye in the building when she shared her story about how, a wave was coming and she was able to run up the beach. Like, yeah, that's an amazing
Especially on
story.
sand too. That alone is a little
I have a hard time with that.
difficult.
Yeah. She had vasculitis, neuropathy, all kinds of stuff, and was told nothing could be done. And that wasn't true.
I just want to point out how chiropractic care in general, it opens doors when medicine closes.
Yeah. I mean, we don't have migraines because of an Imitrex deficiency, you know? And if that's the approach you want to take it. We're actually not, throwing shade on that.
Mm.
We're just saying, if you don't want to take that, we're here. If you've been told you're at the end of your rope, nothing else can be done, we're here. If you don't want it to ever get to that point, we're here. We're seeing a lot of that, but there's got to be a mindset shift. You've got to shift from a victim of your condition to a partner in your healing. And when you ask questions, instead of like, why is this happening to me? If you ask, what does this make possible? There are very, very different outcomes available for you, for sure.
We were just talking about the other day at lunch with acid reflux and that. So can you share a little bit more about why we were talking about that and why it's surprising with the medicine that's given?
What happens with it? Yeah. So, I mean, gastroesophageal reflux disorder, or GERD, is a condition where the symptoms show up as people having acid reflux and it burns. And so, you'd think logically, if something burns, that I want to make it not burn. And so they'll take proton pump inhibitors, which are over the counter medications like um, Prilosec, or there are a bunch. Anyway, Nexium, there are a bunch. What that does is it suppresses the production of hydrogen ions. So, um, long story short, hydrogen ions mix with chlorine in the body, chloride ions, and then we have hydrochloric acid, and that's what breaks down the food. Well, these proton pump inhibitors, also called hydrogen ion blockers, are making it so the body doesn't produce enough of those hydrogen ions. So there's not enough to mix with the chloride. So they can't make enough hydrochloric acid. And then we burn less. Less acid means less burning in this cover up the symptoms model. The problem is that GERD is the result of an underproduction of hydrochloric acid. So instead of it being too much, what happens is it's not enough. Then we eat, and then there's not enough acid to break down the food. So in the time the food should be broken down, it's not broken down. So now the body has to call the workers back in that have gone home, make more hydrogen ions so that they can combine with the chloride ions and make hydrochloric acid. And then that acid goes to try to break down the food. And then those workers go home. But it's still not enough. So they call them and have to come back. And so what happens with the GERD is it's actually not too much acid, it's too little acid. But it has to be produced over and over again over a longer period of time. And so that is what creates the burning sensation. The solution to GERD is not to cover it up by having less acid and making the problem worse and making it so you can't absorb calcium, and then your bones get really weak, and then you have osteoporosis and you break your hip and then you die from a stroke after that. That's only happens about 65% of the time. I mean, literally that's the outcome. It's sad. The point is you need more acid faster so it gets the job done the first time and doesn't have to keep happening. That's what we were talking about. That girl, don't get me preaching. All right, what true healing looks like is there's a distinction. Healing is not the same thing as symptom suppression, and that's what we were just talking.
So one of the things too that I want to talk about is healing is it's restoring the body's design to function.
Yes, well said. The broken roof analogy. If your roof leaks, putting buckets around the house, like pills, it doesn't fix the roof. Correcting the source does. And so you could say, well, it's overkill. Why would you put ladders up the side of the house and climb on the roof and pull back the shingles? That's overkill. I just want to feel better. Uh, do you? I mean, do you go to the dentist and they say, I have a cavity, and you say, all right, just do what you have to do so it doesn't hurt, but I don't want you to fix the cavity. Like, no,
Yeah.
you'd never say that.
One of the things too that we point out we use a lot to explain to patients is you don't say, "Oh, my teeth don't hurt right now, so I'm not going to go to the dentist yet."
Some people do,
Well, yeah,
but
but
that's not smart. I wouldn't do that if
most
I was
most
y'all.
people go every 6 months, which is actually usually because that's when insurance will do it, twice a year. But we always say if you go to the dentist before you have a cavity, then you should do the same with a chiropractic office. You
Exactly.
should get care before you're bone on bone, before you can't move anymore, before you're in the wheelchair. You should maintain your health.
I thought it when I was in undergrad, and I thought, I'm gonna keep going to the chiropractor down here in Missouri because I just thought about that. I go to the dentist to take care of my teeth, and if that goes bad, they can replace my teeth, but nobody can replace my spine, and that houses my nervous system. Somebody must have taught me that. I don't know where that came from. But we also believe it's really big to measure progress. So with the Lazar method, we measure progress with subsequent nerve scans. We show how stress is being released from the nervous system and how it's getting better organized. We do posture IQ that shows structural change. We do digital motion x-rays. So we're showing objective movement restoration and alignment over time. It's a very thorough system, and that's why our patients get the results that you deserve for sure.
We like to have patient testimonies as well. When patients share with us, had Dr. Lazar mentioned earlier, she was in a wheelchair and then was walking just a couple weeks later. The amount of patients that we've had tell us they were in the office, they weren't wanting to leave. Dr. Lazar stayed over his lunch to get everything ready for them, to show them, okay, this is what you need, this is how we can fix it. And they had told Dr. Lazar we had decided if we left here without answers or results that they had their suicide planned. And so
Yeah,
it's it's the amount of times that we've heard that, and just to think about the amount of times that we've heard that, it's happened way more than that because
yeah,
not everyone's going to tell you that.
that's true.
So it's important for patients. It's a healing community around our office, and patients will chat for a little bit and get to know each other, and that's huge.
That is, yeah, that's well said. We want you to rethink what better could mean in your life. I actually think we have a moral and spiritual and ethical obligation to offer our best selves to the world, to offer our best self. The Bible says, present yourself as a living sacrifice. We wouldn't present a sacrifice that's blemished or messed up, or you would present your best. And I actually think God calls us to do that. And I'm excited we get to be part of that. I mean, I don't know of anything else that helps people reach their full potential as much as this, which is really, it's cool. That's an honor.
So if you have been settling for less because you thought that that's all there was, this is your wake up call. Don't just reduce pain, reclaim your life. You can call us now at 866-521-9355 or text HOPE to 734-274-5107 and get the answers that you deserve.
You mentioned the group think mentality, and the tribe effect really does help. It's why healing happens together. Dave Ramsey has done a brilliant job with Financial Peace University in creating a tribe of people. Before the tribe, it would be awkward to say it's not in the budget. What are you, some loser? You don't make enough money and you can't do that? That's what people would think sometimes. I've heard. But with the tribe mentality, I remember being, when we first did Financial Peace University, we would get together with people around our table from church. Um, and we would say, hey, you guys want to get together? And they'd say, we don't have anything left in the entertainment envelope. We don't have any cash left in the entertainment envelope, but we can get together at one of our houses. And that made it okay. It actually made it empowering. So, you know, the point is healing is not an individual thing. It actually is a cultural thing. And the more you surround yourself, look, you hang out with a bunch of people that are sick in a system that's a sick care system, don't expect to get any healthier. It's a cultural thing.
And most of our patients will say, I finally feel like I belong, or I belong here. I'm not crazy. I'm not alone. And that's really important.
And we tell people, we're not saying you're not crazy. You might be crazy, but not about this. This makes sense. There definitely, our office is not a revolving door. It's a movement. I mean, the people here have a big ride or die mentality.
And then with that ride or die mentality too that you were mentioning, the power of being surrounded by people who believe in healing and hope and health is important. And that's why we always say, bring your spouse with you to
Yep.
your appointment,
Yep.
bring your sister, bring whoever you want to be in that circle with you, your inner circle to support you, bring them here. Let them see they can be empowered with you.
For sure. And community accelerates progress, guys. I mean, we need encouragement, we need accountability. We share stories, we encourage each other. The Bible talks about, you know, how you can't break when things are bound together, you can't break it as easily. And that's exactly what that means.
And we tie it to faith a lot. You know, we say a lot. We want you to be at your full God-given potential. But it's also important, you know, you've heard us mention family, the importance of that and support, as well as living with intentional values.
Yeah. Yeah, they're not drifting. I mean, for sure. And the couple you mentioned that had planned their suicide also brought their adult son in, who was in a deep depression after having a motor vehicle accident that ended a woman's life. He was really upset, and he had planned his suicide, and but that whole family went from broken by illness and a bunch of failed surgeries and things to thriving together because they joined the tribe.
So you are not just getting care, you are joining a family that's obsessed with seeing you thrive. So if you've been walking this road alone, today is the day to stop. You can call us now at 866-521-9355.
Or you can text the word hope to 734-274-5107. We'd love to invite you to join the tribe. Again, for being a listener or viewer, if you're watching this online, we'd love to offer you a complimentary consultation that can be virtual or that can be in office. That will save you $224. And we can start a conversation about what's wrong and if this method could help you. And here's the deal. It's a conversation. It's not a commitment. So, you know, find out. And what I would ask is, if there's even a chance this method could help you, if we could get to the cause of your problem and help you start a new life where you don't have to deal with these problems anymore. If there's even a chance, do you think we should at least find out? So that's the question we'll leave you with. This is your weekly checkup. I'm Dr. Lazar.
And I'm Jaden.
I'm glad you jumped in on that. And we're here to serve you in our office in Ann Arbor, here on the radio, here on social media, virtually, however you need. We are here so that you can realize and express your God-given potential. On behalf of our team in Ann Arbor and our awesome team here at WMUZ, thanks so much for joining us, and we'll look forward to being back here with you next week.
God bless.